Rheumatoid arthritis is a chronic condition that brings a world of discomfort and challenges to everyone who suffers from it. However, even people diagnosed with rheumatoid arthritis still don't fully understand what it is, how it can affect them, and what they can do about it. You might know that rheumatoid arthritis is an autoimmune disease, meaning your body's defense system turns on itself. In this case, the body attacks your joints, especially those responsible for the fluid movement and shock absorption in your hands, wrists, and knees. The result? Inflammation, pain, and the potential for long-term damage. But that's just the beginning. In this short video, we'll provide you with more information than you could ever hope to know about rheumatoid arthritis. Let's get started. Don't forget to subscribe to our channel for unlimited tips and tricks to staying young and healthy. Path to a rheumatoid arthritis diagnosis usually starts slowly and sneakily, with small signs that gradually become more severe. At first, a person might notice a slight puffiness or stiffness in their joints, especially in their hands, wrists, and the ends of their feet. This stiffness is often most noticeable in the morning and might last for over 30 minutes. This is a key warning sign of rheumatoid arthritis, but here's the problem. Because RA is an autoimmune disease, its effects aren't limited to just the joints. If it isn't addressed quickly, it can worsen and spread its inflammatory effects to other areas of the body, even affecting major organs like the heart and lungs. This worsening condition can lead to a variety of serious health problems, which is why it's so crucial to recognize and treat rheumatoid arthritis early on. Understanding what exactly causes rheumatoid arthritis is tricky because it often involves a combination of genetics and environmental factors. The situation starts when the white blood cells, which usually protect the body, attack the synovium, the soft lining of the joints that produce fluid for smooth movement, resulting in inflammation. This leads to well-known symptoms like swelling and pain. Over time, this can significantly damage the cartilage and bone inside the joint. On the genetic side, certain markers, like the human leukocyte antigen genes, are known to increase the risk of rheumatoid arthritis. But environmental factors play a role too. Things like catching certain viruses, smoking, or experiencing a lot of stress can often trigger the disease, especially in people who are genetically more likely to get it. Figuring out if someone has rheumatoid arthritis is a complex process that starts with a detailed look at the person's medical history and a physical checkup, paying close attention to signs like joint swelling and stiffness in the morning. Blood tests are key for finding certain markers, such as rheumatoid factor and anti-citrullinated protein antibodies, which are common in people with the condition. Also, imaging tests like X-rays, ultrasounds, and MRIs are very important for seeing how much damage and inflammation there is in the joints. While no single test can confirm rheumatoid arthritis by itself, all these pieces together help doctors figure out if someone has the condition, leading the way to developing a treatment plan. Rheumatoid arthritis is split into two main categories, based on whether specific antibodies are found in the blood: seropositive and seronegative. People with seropositive rheumatoid arthritis have noticeable levels of anti-citrullinated protein antibodies in their blood. This shows that their immune system is attacking their joint tissues. This type of rheumatoid arthritis is also the more common one, making up about 60 to 80% of all cases, and it usually means the disease might get worse more quickly. On the other hand, those with seronegative rheumatoid arthritis don't have these antibodies, which can make figuring out what's wrong and deciding on a treatment a bit trickier. However, the seriousness of their symptoms and the risk of damage to their joints are usually just as significant. Starting treatment for rheumatoid arthritis as early as possible is crucial to the process. This is because it not only helps reduce the symptoms, but also prevents damage to the joints, which often starts in the first few years after the disease appears. The aim is to reach remission, where symptoms are very mild or not there at all. However, it's important to realize that this isn't always possible in every case. In terms of treatment, Approaches range from common pain relief medications like NSAIDs to non-drug treatments, such as taking dietary supplements like fish oil, using heat or cold therapy, and doing specific exercises. On top of these, practices that connect the mind and body, like mindfulness-based stress reduction and biofeedback, are important for dealing with the psychological side of living with chronic pain. Rheumatoid arthritis is more than mere joint discomfort. It's a complex autoimmune disease that requires a deep understanding and a thorough approach to care. Like most health issues, getting an early diagnosis and creating a treatment plan that's just right for you are critical steps in reducing the disease's impact, maintaining a good quality of life, and in some cases, reaching that much-desired state of remission. We hope you enjoyed this video and find inspiration to live a healthy and full life. Don't forget to subscribe to Heyday Wellness for future videos like this.